What if I told you that the cortisone shot your doctor gave you might be silencing the wrong alarm and actually doing permanent damage? I'm Doug Ringwald, a neuromuscular pain therapist, and I'm here to show you what the research says and what your doctor probably isn't telling you. A major review in the Lancet in 2010 analyzed 41 high-quality trials with over 2,500 patients. Cortisone injections did reduce pain in the short term, but at 6 and 12 months, patients who got injections had worse outcomes than those who got no treatment at all. They had higher relapse rates, slower recovery, and even tissue damage in some cases. Multiple injections made things even worse, up to 57% worse outcomes when compared to a single shot. Why? Because these injections suppress the body's healing response. They mask the pain, but they don't fix the cause, and that leads to a bigger issue. Most doctors assume pain means something is damaged where it hurts. But in a 2019 study, both shoulders were scanned in people with pain on just one side. The results? Damage appeared on both sides, even in shoulders with no pain. What shows up on a scan doesn't always match what you feel. In my clinic, people come in with diagnoses like rotator cuff tendinopathy, Achilles tendonitis, or tennis elbow. But when I treat trigger points in nearby and distant muscles, their pain often disappears without ever touching the tendon. Why is that? Because the pain was referred from the muscles, not coming from the tendon at all. And this is the case 82% of the time. Most pain is referred from muscle trigger points and is not the result of local tissue injury. Here's the danger of steroid injections. You inject the area where the pain is felt, like a tendon or joint, but the true source is somewhere else, often a trigger point in a distant muscle. So now you've, one, missed the real cause of the problem, and two, weakened healthy tissue that wasn't the problem to begin with. It's like hearing a fire alarm in your bedroom, but the fire's in the kitchen, and you go and pour water on your bed. There's a better way. Instead of suppressing pain, we can listen to it and trace it to the real source and treat it effectively. That's what we do with coaching the body, trigger point therapy, and pain-free movement retraining. Want the research behind all this? I wrote a full article that breaks it down step by step. You'll find the link in the description, along with free resources for massage and manual therapists, fitness instructors, and pain sufferers. Don't just suppress symptoms. Let's actually solve the root problem.